Hi, this is going to be a presentation about GI bleeding in patients with atrial fibrillation being treated with anticoagulant therapies. The problem statement: GI bleeding in patients taking anticoagulant therapies for treatment of atrial fibrillation. This is the problem that we are discussing. The background here, there is a couple trials that were studied, and I'm going to talk about these two trials. The first trial is the Aristotle trial, compared warfarin and apixaban and the history of bleeding with these medications. The trial included 18,140 participants from 1,034 clinical sites in 39 countries who received at least one dose of warfarin or apixaban. Another trial that we'll be discussing is the Rocket AF trial. In this trial, patients with atrial fibrillation who were taking rivaroxaban and warfarin will be compared. There was a total of 14,236 participants in this trial. The trial assessed the chances of developing a GI bleed associated with these medications. The three nursing domains. First, research. Definitely more research still needs to be done for the new anticoagulant medications. There's only a few studies that I could find, and in comparison, there definitely still needs to be more studies. There's a lot more studies on warfarin than there is on the newer anticoagulant medications. Education. Patients need to be educated about the side effects of these medications so they will be able to identify signs and symptoms of bleeding that are a concern. If somebody gets a minor cut or a bruise, that's not too concerning. But if they have a cut that does not stop bleeding within a certain amount of time, that's something that the patient needs to be concerned about and needs to be educated about. Also, things like maybe avoiding contact sports, things of that nature would need to be discussed with the patient. And depending on their lifestyle, which medication would be the best for them. Practice. Many patients are on anticoagulants, so medical professionals need to be aware of the common side effects. They also need to be aware of the comorbidities that put patients at higher risk for developing GI bleeds. That way, they can best prescribe the anticoagulant fits the patient the best. Comorbidities that put patients at higher risk for GI bleeds, regardless of whether they're on anticoagulants, but these things do increase GI bleeding. It is renal disease, alcohol abuse, reduced platelet count, hypertension, genetic factors, excessive falls, diabetes, increased age, COPD, sleep apnea, long-term aspirin use of NSAIDs, use of H2 antagonists, things that people use for GERD, and a history of GI bleeding. The purpose of this investigation was to see which drug is the safest for treatment of patients with atrial fibrillation and less likely to cause a GI bleed. The medications that we'll be discussing, two of them, are called direct factor XA inhibition drugs. Their names are rivaroxaban, apixaban, or vitamin K antagonist warfarin. For purposes of this lecture, I'm going to use different names that are a little bit easier to pronounce. Rivaroxaban is also called Xarelto, and apixaban is also called Eliquis, and the other name for warfarin is Coumadin. In the Rocket AF trial, 684 of 14,236 people had some type of GI bleeding event. The patients that were on Xarelto had more events than the patients that were on Coumadin. 58% were on Xarelto, and 42% were on warfarin, which is Coumadin. In this chart, it shows major bleeding followed by death within 30 days of taking this medication from major bleeding. And Coumadin had a higher bleeding rate than Eliquis. In this chart, we are comparing the any types of bleeding that they had seen with these medications. The two medications that are being compared are Coumadin, which is right here, and then the other one is Xarelto. Xarelto seemed to have a higher bleeding risk in this study than warfarin. The question that is being researched in these trials is which of the medications are associated with more GI bleeds. Which anticoagulant is the safest for patients to use to treat atrial fibrillation? After reviewing all these trials, there are still many unanswered questions about anticoagulant medication has the least potential for GI bleeding. The three medications were not compared side by side in the same study. In both studies, it did show more frequent GI bleeds when patients had those comorbidities that I discussed earlier on, such as history of GI bleeds, aspirin use, things of that nature, all that stuff I mentioned prior. Also, both studies had a higher occurrence of GI bleeding with the male population. Taking a thorough health history is very important because it helps help decide the best treatment plan for them based on their histories. Also, not just histories, it also has to do with their lifestyles. If you have somebody that is a football player, you would be concerned if you put them on a blood thinner. Also, you need to make sure if they have a history of GI bleeds, how frequent, how low were their H&H, have they ever had to have transfusions. There's many things to consider when you're placing patients on anticoagulant therapies, but it is to help prevent strokes, so sometimes you have to outweigh the benefit and risk factors. More research still does need to be done about the treatment for atrial fibrillation, but we are heading in the right direction. In conclusion, the proper diagnosis and treatment is the key to success for all these patients. There's also something that is very important that needs to be considered is the half-life of these medications. For example, Xarelto and Eliquis bleeding times, they do stop bleeding. I believe it's, let me look. Hold on one second here. The half-life of Xarelto is 5 to 9 hours in a healthy adult. The half-life of Eliquis is 12 hours in a healthy adult. Warfarin at this time has a half-life of 20 to 60 hours in a healthy adult. The thing that is most concerning about this is that, and when reading through these studies, there is no reversal agent for Xarelto or for Eliquis. The only medication that's anticoagulant that currently has a reversal agent is Coumadin, which the reversal agent is vitamin K. So this is also something that needs to be considered. The only thing that they have been able to use that they say they're not even 100% sure if it has been successful in slowing bleeding when somebody was on Eliquis or Xarelto is using charcoal, like you would for somebody that had a drug overdose. But that is not reversal agent at this time. So in conclusion, there is many things that still need to be addressed, and all of these factors need to be considered before you place somebody on any type of anticoagulant therapies. Thank you, and that is the end of my presentation.